Good afternoon, everyone. And we've all seen today's new case numbers, and I would say that that's relatively good news. 14 new cases, 12 more recoveries, and over 700 more tests. This means that what we are doing here in Saskatchewan, it appears to be working. But at the same time, we cannot feel safe, and we for certain cannot be complacent. We've all seen what is happening in other parts of the world and in other parts of our nation. Yesterday, Canada's premiers had a conference call with Prime Minister Trudeau, as well as with the Deputy Prime Minister, Chrystia Freeland. We discussed a number of items, including the shared challenges that we are facing as provincial and territorial areas together, and the different circumstances that each of our regions is confronting. First of all, I would like to take a moment to recognize the leadership of my provincial counterparts. Premiers Horgan, Premier Ford, and Premier Legault have been confronted with an incredibly difficult circumstance caused by COVID-19 in their respective provinces over the course of the last number of days and couple of weeks. And each Premier has demonstrated leadership in facing these challenges head-on. Premier Legault outlined the rise of COVID-19 in many of Quebec's long-term care facilities, a risk that is present across the country and remains present right here in Saskatchewan. So far, we have been fortunate that our long-term care facilities and other such care homes have not seen similar outbreaks. But we must remain vigilant in our efforts to reduce the risk to these facilities and to the residents within. So today, the Saskatchewan Health Authority is introducing additional measures to further decrease this risk. Temperature checks and symptom checks will now occur before each and every shift for workers in these settings. Visitor restrictions will remain in place, barring individuals from visiting these facilities except for compassionate reasons. We've seen the impact that this virus can have on our seniors, and these measures will increase protections to reduce the spread of COVID-19 to our seniors. Premiers also discussed the ongoing concerns regarding the availability of personal protection equipment. The availability of personal protective equipment is a discussion that is more urgent today after the reckless direction of the Trump administration, the direction they gave for 3M to cease shipping N95 masks to Canada. This decision is nothing short of a betrayal of our two great nations' shared history of working together in times of need. Canada and the United States of America have long been each other's closest allies and closest partners. And under the leadership of numerous presidents, the United States have been here to support our country. And throughout history, Canada has supported our neighbor to the south through times of war, terror, and times of economic crisis. And in this time of a pandemic, it is even more important that our nations strengthen our resolve to work together to fight this unseen enemy, this enemy that we call COVID-19. So today I have been and I will be in contact with a number of American governors with this message. And to President Trump and to the American administration, you should reverse this decision. As the residents of our country self-isolate, our nations must not. As we stay apart, we must also pull together. So as we head into this weekend, my message to the people of Saskatchewan would be this. What we are doing is working. And I don't know if we can avoid the kinds of outbreaks that we are seeing in other places, but we have a chance. We have a chance if we continue to follow the rules of physical distancing. Avoid gatherings with people outside your immediate household. Stay home as much as possible. Avoid unnecessary travel. Self-isolate for 2 weeks if you just returned from foreign travel, including travel from the United States. Self-isolate if you are experiencing any symptoms at all. Take the online assessment test or call the 811 health line if you need any health information. Wash your hands and then wash your hands again. Now people, they may be getting tired of hearing me say these things, but I'm going to keep doing it. I'd rather people be sick of listening to me than sick with COVID-19. And as we are home over the weekend, People may want to relax these practices a little bit. Don't. Just don't. Keep your guard up. It's working, and it will continue to work, but we have to keep doing it every minute of every day. Later this afternoon, the government will send out another emergency alert reminding everyone in Saskatchewan that the state of emergency is still in effect, and reminding everyone of the rules and the guidelines that they must continue to follow. Once again, I want to say thank you. Thank you to all Saskatchewan residents for everything that you are doing. Let's continue to pull together by staying apart. I'll now turn it over to Dr. Shahab.
Thank you, Premier. So as before, I'll go over some of our numbers and then over some of our key developments over the last 24 hours. So as in the news release, we've got 14 new confirmed cases, out of which 10 were tested in the province, 4 were tested outside of the province, not yesterday, but these were tests that have come to us over the last 24 hours. So we actually have 10 cases which tested positive within the province out of the 14. We're very glad to state that 48 individuals, so 21% of our total, have actually recovered. So I think that's a very important number to watch. Of the 220 cases in the province now, 102 are returning travelers, 52 community exposures, 10 we don't know the exposure yet, 56 under investigation. And like we have been saying for some time now the numbers, when we look at numbers on a daily basis as part of the investigations, some we expect that they are close household contacts. Some are actually now local transmission, whether in the home setting as close household contacts, which we would expect, and also, unfortunately, in essential workplaces, which may be healthcare, which may be grocery stores, which may be other essential industries. So that is in terms of there's in the news release a mention of an employee at Eden Care Assisted Living Facility. I just want to remind everyone that there's kind of 3 types of levels of care. One are personal care homes, which are usually privately owned and operated and provide both accommodation and care. And these are actually people, they're treated as homes. But the care includes bathing, toileting, help with taking medication, getting dressed. They're regulated under the Personal Care Home Act. And there's about 250 homes with about 4,600 beds. Then there are long-term care facilities, which are about 151 facilities with about 8,800 beds. And these are also called special care homes or nursing homes. And these provide care to those with heavier care needs, which cannot be met through home care or personal care homes. And these are operated by the Saskatchewan Health Authority or by affiliates under contract. And then there's assisted living facilities. We don't have an exact number, but these provide more housing and hotel-like services and not direct clinical care. They allow residents to age in place independently. They can include help with meals, social activities, and housekeeping. So it's really important that these are all places where people who live there may be at higher risk, and as visitors, we have to be very careful when in terms of visiting and complying with any restrictions in visiting. Staff obviously have to go in all these facilities to provide the appropriate level of care, and they are now going to be monitored twice a day with health checks to make sure that staff are unable to work if symptomatic. But we have to remember that despite all these precautions, sometimes staff may work for a period of time before realizing they are not well, and then they are to isolate and go home and inform the manager. With that, I'll ask Dr. Maurice Hennink, who's the medical health officer in Regina, to just give a bit more detail about the investigation at Eden Care. Dr. Hennink?
Good afternoon, Dr. Shahab. Good afternoon, Premier and audience. On the afternoon of the 2nd of April, the Regina Public Health Office of the Saskatchewan Health Authority identified a positive COVID-19 case that works at an assisted living care facility here in the city of Regina. Investigations led to a number of measures put in place to ensure control of any further spread of COVID-19 in this situation, the safety of the individual involved, their family, and the staff and residents of the facility. Active monitoring of the facility continues, and with various steps that have been put in place to ensure continued control of the situation, has been done. The individual was identified through a contact tracing process, through other positive individuals, and in this way, we were able to intervene positively and early as best we could. The facility is currently obviously closed to all visitors, admissions, and discharges. Staff are cohorted to this facility, and as Dr. Shahab indicated, we are actively monitoring as well the staff as well as the residents of the facility. And that's the situation at this point in time. Thank you.
Hennink. And finally, I'd just like to mention that there are many measures in place to license additional healthcare and other professionals. Retired employees now are going to have an easier and quicker way to get re-licensed to provide urgent care. The Ministry of Health has been working with professional health bodies to put measures in place to provide temporary licenses for retired non-practicing and student members where appropriate. And the government of Saskatchewan is covering the fees of these professionals, which can cost several $100s per member per year, depending on the regulatory body. So with that, that's the end of my update.
Thanks very much. We have about 25 minutes for questions. Operator will take our first question from the line.
We have Matt Young with CTV.
Oh, hello. Can you hear me?
Yes.
Hello?
Yes, we got you, Matt.
I have just a quick question. It appears Saskatoon has a lot more cases than any other communities. In fact, far more, double in some cases. Is there a particular reason why that might be? Any insight into that? The nature of the city? Perhaps is Saskatoon a city with more travelers? Is there any insight into why Saskatoon would have so many other cases than a city like Regina?
Yeah, thank you for that question. So initially, actually, Regina had more cases than Saskatoon like 2 weeks ago. Part of the explanation historically was if there's large group exposures, then that generates a larger number of cases and contacts. And that is also the reason why, for example, the North at 42 also has a high number of cases linked to an exposure event. Over time, we expect to see the rates more or less stabilize, and that's a flag that if we don't do that already, we should also show the rates at a population level, because that may smooth out some of the variations over time. But thank you for that question.
Do you have a follow-up, Matt?
No, thank you.
We'll take our next question from the floor. Arthur?
So we now have this case where there was the employee who was tested positive. I noted that a new measure that's in place for long-term care workers does not apply to these assisted living residents. Given that we already have a case in one of those homes and there are seniors living there, why not extend it more broadly to apply to all seniors' homes, to do screening, to do temperature checks, to adopt more restrictions?
So we expect all employees who work in essential services to actually do the self-monitoring, and all employers to implement that. And as you know, for some time now, there have been specific exemptions for essential industries, like, for example, trucking, where you are able to work while well and don't have the same quarantine measures in place, for example, if you cross the border, but you are still restricted, obviously, from going to large group events or those kind of things, and you are to isolate yourself immediately and inform your employer if you become symptomatic. So the same principles that apply to long-term care facilities will apply to all other settings, but it's up to the employers in those settings to, SHA is not the employer for many of those settings, but it's up to the employers to implement that in a way that promotes continuity of service, but also is able to screen as much as possible people who are unwell. But we have to remember that additional precautions over time may be required, because like cohorting, like Dr. Hennink said, and other precautions, because sometimes in the early stages of illness, you may not be actually showing a lot of symptoms.
You have a follow-up, Arthur?
First off, could you explain if that expectation is in order, that these assisted living homes would also need to apply these screening measures that we've now put in place for long-term care facilities? And then to the Premier, could you explain, given this situation, how concerned you are that we're going to start to see some of the outbreaks that have been devastating Quebec and BC seniors?
So I think we have to be very clear that the order really is for everyone to stay home and not go to gatherings of, large gatherings, those kind of things. There have to be exemptions that are specific to that industry and appropriate for that industry. The recommendations and the compliance measures that are in place for the Saskatchewan Health Authority are in place for long-term care facilities. But we have to really ask employers to put in screening processes that work the best for them in their context. And I'll see if Dr. Hennink has anything to add at this point as he's working with the employees in this specific instance.
Shahab, I think our advice to our personal care homes that we interact with from time to time, as well as the assisted living facilities that certainly consult us every so often, we certainly would strongly encourage them to adopt the direction that has been given and that we are taking for our SHA long-term care facilities and affiliates. And I'm confident that in most instances they certainly will be looking at that implementation to ensure the safety of their staff as well as their residents that they're taking care of. Thank you.
And I would just say that we remain, extremely concerned with respect to COVID-19 getting into any of our care facilities, whether it be assisted living, whether it be personal care homes, whether it be our long-term care homes, which is why we acted quite quickly and aggressively with the visitor restrictions that we put in place under Dr. Shahab's recommendation. Now we are in, Dr. Shah had referenced this yesterday, that often you will see staff at these facilities that will be wearing a mask, if you will, to protect the patients and the people that are in those facilities, where we might often think it's the other way around. And that is what we are seeing here today, is where we have a positive ID of one of the staff members. And so there are some steps that are being taken today with the government-run facilities. I think the expectation, as Dr. Hennink had said, and the hope is that all of the facilities will adhere as well to the self-monitoring, which healthcare officials are doing already, but also the additional temperature checks in their facilities to try to identify if there is the potential of a COVID-19 case as early as possible in one of these facilities. You referenced Quebec. Quebec has about half of the positive cases in Canada, and we're very much aware of that. I've been in contact with Premier Legault on a number of occasions discussing the challenges not only in getting to those numbers, but the challenges and the pressures that are being placed on the healthcare facilities in Quebec now that they have in over 100 people that have COVID-19 in their healthcare facilities as well. So we're most certainly aware, and we'll be watching this very, very closely in the days ahead to ensure that we don't have a similar outbreak in our long-term care facilities. And we trust and put our faith in the work and recommendations that Dr. Shahab has put forward, but also the work of our public health care officials, Dr. Hennink, and we and his colleagues across the province. And so we are listening intently to the advice that's being put forward, and we'll act very quickly as it transpires.
We'll take our next question from the line. Operator.
We have Adam Hunter with CBC.
Hi there. I'm wondering, we've had people making calls for mask wearing by the general public. The CDC has been reported as maybe recommending mask wearing for the general public. This is all related to asymptomatic carriers, people that aren't showing symptoms, of course, and may be positive cases. Is Saskatchewan considering this as a recommendation? Why or why not?
So I'll walk through where the science is and what we are doing currently and what could potentially be opportunities going forward. So what the science now says is that if you look at everyone who gets exposed About 10% of people are infectious without really having any symptoms. About 20% have really mild symptoms, maybe a cough for a day or two and then nothing else. And then about 50% have more significant symptoms, but still well enough to isolate at home. They may have cough, fever, chills, malaise, headache. They're the ones who actually call Healthline and get tested. It's not practical to test the entire population to detect the 30% who have either a cough for a day or two or no symptoms, and of course, up to 20% may require hospitalization. So with that in mind, what we're doing right now, for the most part, protects us from each other. Physical distancing, 6-foot separation, hand washing before and after going out, not going out if you're symptomatic, not congregating in groups if you're not in the same household. So that is essential and is irrespective of mask use. We have seen in Southeast Asian countries where sometimes you can't avoid a crowded situation, whether it's a mass transit or other setting, where yes, mask use did show benefit. We do, however, realize that currently PPE supplies are adequate for healthcare staff, and they have to be preserved for healthcare staff who have to wear masks to protect themselves when looking after patients, but also now more and more in ER and other settings to wear a mask, because as essential workers, they don't have the luxury of staying home. They don't sometimes have the luxury of staying home if they were in contact for the full 14 days. They go a health check and have to go to work, but a mask can protect themselves from patients, but also protect patients from themselves. So those are the medical grade masks. And there has been discussion, from the federal government and others about other masks that may not be medical grade, that may, for example, at least if you are sick, protect others if you cough in terms of droplets. But we have to remember that that still doesn't mean that you should start crowding together wearing a mask. You have to maintain that 2-meter separation. As supplies of PPE for healthcare and other masks that may not be health grade increase and stabilize, there may be opportunities for limited mask use, for example, in assisted living facilities, but that really depends on supplies, and that should not be at the cost of pulling supplies away from healthcare. And for the general public, again, all the people I watch walking around, maintaining that 2-meter separation, mask use will not make a difference in our setting, which is, we have abundant open spaces, we have quiet streets, and in these settings, mask use or not mask use doesn't make the difference. It's maintaining that physical distance.
Follow up?
I'm wondering, we've seen sort of consistent numbers as far as infections daily, in the range of 10, a little bit higher, a little bit lower. We haven't seen a big spike for a few days. Is that encouraging to you, what we're seeing? I know the Premier mentioned that we need to keep going on this. And I know we're talking about modeling next week, but is this giving us some indication that maybe we're just seeing consistent numbers as far as infections, recoveries, et cetera?
So overall, I think the daily case numbers are to some extent reassuring that they're not going up exponentially. However, we are seeing that less and less of those are due to travel. So initially, that was the only source of exposure, importation due to travel. Now that is less and less the case. Maybe 3 out of the last 10 were due to travel as an estimate, but obviously that proportion changes. Some are close household contacts. That is expected, and we want to work towards minimizing that, to understanding how can we better improve self-isolation at home, especially if it's a crowded setting, and that's not fully possible compared to a smaller household. And third, of course, is that we are seeing transmissions in settings where essential work has to happen. Now, essential work cannot stop. Healthcare has to be provided. Other essential work has to continue. But through a variety of steps, like was discussed for assisted living facilities, we want to understand where transmission is happening, why it's happening, and that's the work public health does in great detail, and try to implement procedures and recommendations, may not always be orders, to minimize that transmission. And we have to remember, people who are working in essential services for clients, no one wants transmission to happen, but we just need to learn where transmission is happening and just improve our protocols on a continuous basis to keep the curve, as you said, as flat as possible.
We'll take our next question from the floor. Steph?
Mr. Creamer, do you think Canada needs to start manufacturing more personal protective equipment, more N95 masks in light of this dispute and the fact that some countries may want to be keeping this equipment for themselves because they need it for good reasons versus sending it elsewhere?
Yeah, and not for today's reasons. I've felt that for some period of time that we traditionally have relied in our supply chains from around the world. When it comes to some of our healthcare supplies, I think we do need to have a very serious discussion about having them manufactured. We have the capability to do that here in not just in Saskatchewan, but in other areas of Canada. Personal protection equipment like gloves, like gowns, like N95 masks, ventilators that would be utilized in ICU. They are in short supply around the world, and you are seeing countries that otherwise wouldn't make decisions like we saw the U.S. make today that are making these decisions to protect, in their view, protect their residents. So the premiers are actively discussing the opportunities, and Premier Ford has spoken, I think, a number of times to the opportunities that we have engaging with the manufacturing sector in changing over some of their manufacturing lines, if you will, to produce some of these products. And we are encouraged by that conversation and the individuals that are involved, and we look forward to ultimately having some results with some Canadian manufacturing of some of the masks, some of the ventilators and such.
Follow up?
Talking to the premiers you did yesterday, have you offered up any of Saskatchewan's ICU beds or any other PPE to provinces, say Quebec and Ontario, where cases are that much higher and there's more pressure on the healthcare system?
We have not done as yet, but we did have the discussion about which provinces are peaking and when. That's, I think, you're seeing some of the modeling come out with Ontario today. You'll likely see other provinces, including this one, come out with some more refined modeling, if you will, than what we have discussed before in Saskatchewan. Trying to really hone in on what this means to our healthcare system, what this means to our community, and trying to start to think about when we may be at a peak point so that we can, if necessary, and we have not offered this as of yet, but we are one nation, and we do have provinces that are short of supplies today and tomorrow. And so we did have the discussion, one, about how we procure PPE equipment with our national government as a nation, how we share that as it comes in, ensuring that the areas that need it get it, and understanding that at some point in time that would be Saskatchewan as well.
We'll take our next question from the line. Operator?
We have Lisa Schick with CGME.
Hi. My question, I guess, for whoever feels like they want to answer it. Today, the Privacy Commissioner put out a statement kind of encouraging more transparency, saying that officials are always free to provide the identified personal information, kind of giving permission, I guess, to say how many people are sick or pass away in a city, town, or a municipality. Given this coming out from the Privacy Commissioner, is there any chance of the province changing how it reports these numbers?
Yes, thanks. So as you can see, the deaths now are given by parts of the province. As the numbers increase, that does become easier to do. But I have to reinforce that actually, unfortunately, if a death happens, there's no difference in the virus in terms of if a death happens or someone gets a mild illness. The virus is actually exactly the same, and the outcome actually is determined by a variety of factors: age, underlying health conditions, other factors. So I have to reinforce that, often when you show a community or a region with more cases, or, there should be absolutely no sense that, okay, I'm fine because I'm in this part of the province which has low number of cases. So I think that absolutely would be a very risky assumption if people looked at a map or a table and said, oh, well, I'm okay in this part of the province. Having said that, as numbers increase, certainly that data can be carefully provided in greater detail at a sub-provincial level. But I think, we always have to remember that, as far as we can tell based on our testing numbers and test results, there's no part of the province that one can say, okay, I don't have to practice hand washing, physical distancing, all the other precautions that everyone else has to practice.
Follow up on the line?
Yeah, I mean, people that we're hearing from seem to want to have that information. Just wondering if the Premier agrees with Dr. Shahab here.
Yeah, I would, I've also heard, with respect to a number of individuals that have contacted me, friends, family, constituents, people across the province, that they would like continued increases, if you will, in the information that we're providing with respect to geography of positive IDs, towns, villages, cities, where they are from. We have endeavored, as I've said, to expand the information we're providing as we move through the days, and this very well may be the direction that we head in the days ahead as our numbers start to be larger. I wouldn't preclude whether we will or not. I would say that we will divulge that information, understanding the Privacy Commissioner has made some statements around this today. We would release that information on the advice of Dr. Shahab with the input and information that would be provided to us from the Saskatchewan Health Authority. So continued, as I said, to be a conversation in progress, understanding that the people of the province have asked for this, and as our numbers are increasing, if there are no objections to it, we may look at it in the days ahead.
We'll take our next question from the line, operator.
We have Roberta Bell from Global.
Hi, my question was for Dr. Shahab, or the Health Authority, I guess, in regards to the licensing, the temporary licenses. I was wondering how many workers you potentially anticipate needing and how many you might expect to get.
So I think from my side, I'll say that we will share that information as it becomes available from the regulatory authorities, but I'll defer to Scott Livingstone or Dr. Susan Shaw if they want to add to that.
Do we have anything to add from Scott or Dr. Shaw on the line?
Susan, do you have anything to add? I don't have anything to add.
I don't think I have anything to add at this time either.
Do you have a follow-up, Roberta?
Could you tell us what kind of roles you expect that these professionals could be filling? Are they going to be like in the ER, or are you expecting them to just be in long-term and assisted living facilities, more like in the background?
I think I'd like to say that we would like, sorry.
I think that as we're starting to better understand what the operational plans would be for surge capacity, it'll become more clear what the roles are. I think it'd be very important to always be working with the individuals to understand what their skills, what their past areas of practice were, and how they feel they're best able to contribute, and those factors would, of course, be considered.
And we'll take a last question from the line, operator.
We have Dan Jones with MBC.
Yeah, good afternoon, Premier. I've seen increased calls from the NDP now and also the FSIN to increase supports to First Nations, Métis, and Northern communities. Can you tell me what the province has done tangibly to help these communities deal with testing, tracking, and ensuring the supply chain is intact?
I had a conversation, a number of conversations with Chief Cameron, as well as a number of other chiefs. I know our Minister Carr has also been on the phone with a number of chiefs across the province, including and particularly throughout the northern areas of the province, to have conversations around how we are safeguarding those communities and how we can work mutually to ensure that we are doing everything we can to prevent COVID-19 from entering, or at least keeping it at bay as much as possible in our Indigenous communities and in our northern and remote communities in particular. Had good conversations with respect to what some of the challenges are as some of the testing supplies in Indigenous healthcare centres come through the federal government, as to what those numbers are, how they can access additional tests by accessing the 811 provincial health line, working with the province on on the access points that we have, not only in the business community, but also in the healthcare community. So I've had good conversations, like I say, with Chief Cameron as well as a number of chiefs across the province, as has Minister Carr. Minister Ryder as well was on one of these calls this week, and we'll have more in the days ahead to work collaboratively to ensure that all of our communities, Indigenous or otherwise, we're working collaboratively with them.
Do we have a comment from the SHA on testing efforts in the north?
I can add that we have I think we've been working hard to have very good working relationships with tribal councils, with nations, and with both Métis Nation Saskatchewan and the FSIN, and we continue to have good conversations about how we can best support our partners so that all people in the province of Saskatchewan, regardless of who you are or where you live, are able to be safe.
Do you have a follow-up, Dan?
Yes. Saskatchewan Tribal Council Chief Mark Arcan expressed concern over enforcement of COVID-19 restrictions on vulnerable and homeless people, suggesting that some of these people may not be able to actually A, afford the fine, or that B, they have really nowhere to go, given that they are homeless and they may get caught with a ticket. Have you had discussions with First Nations leaders and police about enforcement measures and maybe being more on the compassionate side, given that some of these people may not have access to adequate housing?
Yeah, those discussions have occurred, and you'd note earlier this week the Public Safety Agency, as well as local law enforcement and provincial law enforcement, had discussed a new access point, or it was always there, but a new access point for people to call in the Public Safety Agency to triage some of the concerns that people have, where people may not be abiding by the recommendations and the orders that have been put forward by Dr. Shahab and the government of Saskatchewan. Most certainly the goal is compliance. The goal is not a charge or a fine in any way. The goal is compliance. That's why these are put in place, and by far and away the vast majority of individuals are complying with these. With respect to some vulnerable populations, predominantly in our larger centers, Minister of Social Services was out earlier this week with a first step, if you will, of some of the supports that are being provided to that population, to our shelters. He's working actively with the operators of those shelters as we speak, on the phone earlier today with them to ensure that the processes that are in place are in the best interests of protecting those that are most vulnerable in our community, ensuring they have a place to stay at night, but also ensuring that should they have symptoms of COVID-19, that there is an active process, a very active process in place that will address those symptoms and provide the opportunity for guidance on self-isolation, as well as, if needed, the place to self-isolate as well. So those conversations continue with the Minister of Social Services and the operators of many of our homeless shelters here in the province.
And we'll take our last question from the floor. Arthur?
So this is sort of related to that. We've been hearing from mayors and frontline services across the province. They've said that there's a disconnect between social services and the Ministry of Health in some cases. We've heard reports of homeless people with symptoms being bounced between shelters and hospitals. I'm just wondering what you're doing as Premier to coordinate the new government's efforts to respond and protect the homeless.
Well, the Minister of Social Services is actively involved in this file. As I said, he hosted a call earlier today with the operators of shelters in our larger centers, a number of centers across the province, working closely with them with exactly where those gaps are, and how can we work collaboratively together to ensure that we are closing those gaps so that people, A, have a place to stay, understanding that many of our shelters have made efforts to ensure that physical distancing is in place, which provides at times for lesser capacity in those particular shelters. So that capacity needs to be provided. Minister of Social Services is ensuring that that will be provided. He's working with those shelter operators to ensure that it's provided in a timely manner, as well as ensuring that the process for those that may present with COVID-19 symptoms or been in contact with someone with COVID-19 in what I think we can all agree on, maybe quite a vulnerable population, that the process for getting that individual to isolation first and foremost, and then to have a test done are happening in a very fluid and effective manner. So this is, again, a work in progress. The Minister of Social Services is in very close touch with the Minister of Health and very close touch, as I said, with the shelter operators in our cities as well.
Follow-up?
One quick follow-up. We've been hearing a lot of reports from Sun and from nurses that they're concerned about the amount of PPE that they're already being provided. And I know that you talked about a lot of measures that are being taken with other provinces, with the federal government to ensure that we have PPE, but it sounds like a lot of that is quite long-term, relying on manufacturing orders where we're competing with other countries. What can you do to ensure those nurses and healthcare providers now that they will get the PPE that they need?
I'll leave the immediate, an answer to the immediate PPE supplies maybe to Scott Livingstone or Dr. Shaw or Dr. Shahab if he should so choose. On the more strategic efforts that are occurring across the nation with respect to ensuring that not only do we have the appropriate amount at the appropriate time for personal protection equipment, not just here in Saskatchewan, but to all our fellow Canadians across the nation. Premiers are engaged in a weekly call on this specifically, as health ministers are discussing this, as well as our provincial procurement ministers also discussing, ensuring, and tracking down every lead that we have within the nation and around the world on how we can access personal protection equipment, additional personal protection equipment, and working very closely with our federal government on this, as well as we have a joint procurement agreement in place, and we're very positive on the ability for us to access this equipment, understanding that every jurisdiction in the world is looking for the very same things. They're looking for N95 masks. They're looking for other surgical masks. They're looking for gloves. They're looking for gowns, and so are we here in this province. But we are working very hard on this at the leadership levels, all of the leadership levels of the respective provincial and federal governments in this nation, and putting all of our horsepower behind it. With respect to immediate supplies, Scott or Dr. Shaw, would you have any comments on that?
Yeah, I thank you, Premier. And just to follow on, from an SHA perspective, the safety of our staff and our patients is our #1 priority. With respect to existing supplies, and you've heard me say this before, we are not experiencing a current shortage of PPE. We have the PPE we need at this phase of our work around pandemic planning. Just as Sun and other members of other unions have raised those concerns, we share those concerns about the future and what that looks like for PPE as we move forward with our planning as well as our response to the COVID surge. But to the Premier's point, there's lots of activity going on to secure supplies for us. But as I said, we're not experiencing a shortage right now. As you see a small number of hospitalizations, we're not burning through PPE like you see in other jurisdictions that are experiencing different peaks in demand, in particular Quebec and Ontario. But we are managing those supplies provincially, and we are monitoring our orders as well as our received orders. But it is a concern, but we currently are not experiencing a shortage.
Thanks very much, everyone. That's all the time we have for today.